Good afternoon. My name is Dr. Anand Sinha. I am a pediatric surgeon and pediatric urologist in Fortis Memorial Research Institute, Gurgaon. One very common problem which we see in children is to do with their genital organs, especially in males. In boys, we see a condition which is called as hypospadias, which is very common. So like in 1 in 300 to 400 children or 300 males will have their urinary passage is not at the tip but somewhere down. That is called as hypospadias. The baby will be normal, passing urine from this hole, but the passage is not located at its normal position. And this condition requires a surgery in which we make a passage of urine from this point to the tip where it should normally be. This is a very delicate and fine surgery. With expertise and with years of experience, we have been able to give excellent results in these cases, and I get a lot of complicated cases also which have been already operated 5 times, 6 times and had problems, and then we are able to give them a good result after this. A similar condition like this is when the urinary passage is not here but on the back side of the penis, which is called as epispadias. This is not as common as hypospadias, but again requires a technically demanding surgery. No risk involved to the child. They come out very safe of these surgeries, and we provide them excellent results at our center for these conditions. But a very major variant of this is when the entire bladder is also open outside on the tummy. So your bladder you can see outside. It looks very dramatic, like a red patch on the lower tummy where the bladder patch is completely open. This is called as an exstrophy. Again, not a very common disease, requires surgery to correct the defect, and later on, because the bladder plate is smaller, they may require further surgeries also. In such conditions, the surgery requires a longer stay, and again it requires a lot of technical expertise to handle such cases. We are able to manage such cases, and we are able to manage complicated such cases in our center. And lastly, when it comes to genitals, we have disorders of sexual disorientation. Means a child is born internally like a male, looks like a female from outside, or is internally a female but looks like a male from outside, and we have to do a proper gender reassigning. Means we have to convert the male into a female or a female into a male so that they look the proper gender that they are born with. These conditions also need delicate surgeries to be done at the right time to give a very good result to the children. Some rare cases are some children who are born with complete absence of the penis. They don't have penis at birth, or sometimes they had a surgery which was catastrophic, which had accidents and result in loss of the penis, in which we make a new penis out of the body's tissues also. So these are complicated surgeries, require a lot of expertise, and we are a center where we do a lot of such cases and we provide excellent results to these kind of children.